Chapter 9, Pre-Examination Pre-Analytical Complications Causing Medical Errors in Blood Collection. In this chapter, we're going to be reviewing not only what items might cause specimens to be rejected from the lab, but also medical errors that us as phlebotomists can cause that could cause complications to our patients during draw practices. Also, too, what happens to our specimens if the patient doesn't adhere to their diet restrictions. I will be trying to reference to pages in your textbook as well throughout this lecture PowerPoint. Okay, the chapter learning objectives you can view on your own. So we're going to look at categories of pre-analytical variables. So variables important to specimen collection include the patient assessment and physical disposition. This would be, for example, when you go to look at a patient, you're determining which arm is most suitable for the venipuncture. Also, too, what size vein you have to work with depends upon the test request. So they might need to be fasting, they might need to be drawn in the early morning, they might need to abstain from exercise prior to being drawn. Specimen transportation, so this would be going back to chapter 12. Does a specimen need to be refrigerated, frozen, room temperature? Specimen receipt in the laboratory, so making sure that we get the specimens to the laboratory, and we're also too verifying with them that, of the special temperature changes that the specimen might need to be accommodated. So we have controllable variables, psychological variables. So these would be, your book actually gives some examples of this to where we got to take into consideration things we have control over. So like we have control over adhering to a diet. We have a control over making sure that, we're coming in fasting. So there's variables that we do have control over. Specimen collection variables, we have control over the type of needle we use, what type of cleaning prep we're going to use for that particular patient. What position do we need our patient in order to draw the blood effectively? We're also going to look too at other things that we might have control over in those circumstances with specimen collection. Uncontrollable variables would be biological influences. We don't have a control over, the gender of the patient that comes in, or the age of the patient, or that they were born, with missing a limb, or various other things. Environmental influences we have to take into consideration is that some places with elevated, like in the mountains, their circadian rhythm might be different. Underlying medical conditions, we wouldn't have control if the patient came in and they were diabetic, let's say, so we need to draw them right away. So there is things we have to be aware of. Controllable can affect the results of laboratory analytes. And like I said, the controllable ones would be diet, lifestyle, exercise, posture, travel and prolonged bed rest, where the uncontrollable is what we covered here. Basal state, early morning, approximately 12 hours after the last ingestion of food. Laboratory results on basal state specimens are most reliable. Most hospitals, this is why we would draw the patient at 5 a.m. This is to determine the concentration of body constituents such as glucose, cholesterol, triglycerides, electrolytes, proteins. Would have a great impact on the basal state. They're the most reliable. There are several factors including diet, exercise, emotional stress, obesity, posture, tourniquet application that could change a patient's basal state. So it's something as healthcare providers we need to be aware of. Okay, that slide's not wanting to present, so I will go back to it. And this is kind of what I was just covering, the things that can change our basal state. So we'll go back to our slideshow. Sorry about that. The diet, term fasting refers to abstinence from nutritional support such as food and beverages, except water. The required time period necessary from abstaining usually is 8 to 12 hours. They recommend that a fasting beyond 12 hours can lead to erroneous results since normal laboratory results on a fasting level is 8 to 12. So we need to ask the patient, have they been fasting? And also relay to them, when's the last time you had something to eat or drink, and get a time frame. Before collecting a specimen, the healthcare worker should ask the patient if they've had anything to eat or drink. We do encourage water intake because that helps us as phlebotomists obtain a sample, but being mindful too that a non-fasting needs to be documented on the requisition or directly on the specimen itself, so that our lab understands that this is a non-fasting sample. Okay, diet, blood composition significantly altered after meals and consequently unsuitable for many clinical chemistry tests. So if a patient has eaten recently and the physician still needs the test, the word non-fasting must be included again on the requisition or directly on the specimen itself. The other thing we need to be mindful of is that if a patient were to have coffee, chewing gum, and tea, this should be avoided because it actually could cause blood sugar levels to be elevated. The healthcare worker has to explain fasting restrictions to a patient. Instructions should be thorough, clear, with emphasis on important points of the procedure. A turbide or lipemic serum. If the patient has recently eaten fatty substances, he or she may have a temporary elevated lipid level and the serum will appear lipemic or cloudy. I will provide another PowerPoint that actually shows an image of this as well as some other things in our book that we'll cover in Chapter 9, just so you have a reference point to view. Because the lipemic serum does not represent a basal state and may indicate some chemical abnormalities, documentation about the appearance of serum may be useful to the physician. The specimen would be referred to as milky cloudy. It almost looks like a thickened type of serum. This can be caused by ingestion of meat, butter, cream, and cheese, which causes the lipid levels to go up. And it doesn't document a basal state. So this would be an example. You went in for a fasting test and you decided to have a McDonald's sausage biscuit before going in. That wouldn't be a fasting level. Obesity. Obese patients generally have veins difficult to visualize or palpate. The vein is not assessed when first punctured. The healthcare worker must be careful not to probe excessively with the needle. This is why we have 2 attempts to obtain a specimen, but we want to be mindful that if we excessively probe around the arm, this could rupture red blood cells and increasing the intercellular contents and release some tissue clotting factors as well, which could throw off the patient's laboratory results. Damaged, sclerosed, or occluded veins. Obstructed or occluded veins do not allow for blood to flow through them. Sclerosed or hardened veins are a result of inflammation and disease. These veins repeatedly are punctured, often become scarred, and feel hard when palpated. These sites should be avoided if not easily collected from. CLSI advises against collecting arterial blood specimens as a substitute. It would feel almost like hard and cord-like, could be mistaken for a tendon, but the biggest factor is that when you see the vein on the outside, it looks really good, but when you go to palpate it, it wouldn't be soft and have that rubber band bounce back. A thrombus or thrombi are solid masses derived from blood constituents that resides in the blood vessels. A thrombus may partially or fully occlude a vein or artery, and such occlusions will make venipuncture more difficult. These are things that a patient would be very protective of if they've had a blood clot in their arm. We want to be mindful of that. We don't want it to travel, which could cause an embolus. Allergies, we're going to check color-coded armbands or posted signs indicating specific patient allergies, and I'll post some examples of these in my other PowerPoint. Chlorhexidine used as an alternative to decontaminate the site. Latex-free tourniquets, gloves, and bandages are recommended. Most of our products are latex-free, but we also want to keep in mind and look at the product to make sure. Many patients are allergic to adhesives now used in bandages and will experience a rash, so we want to avoid this. So we're going to fold a gauze square over the venipuncture site, wrapped with what we call a Coban. Okay. Exercise short-term effects versus long-term. In general, moderate or excessive exercise has an effect on laboratory test results, but it's up to the physician to interpret the effects. Exercise has an effect on hemostasis. The one thing that we want to be aware of with this is that the impact it could have is that it can cause an increase in our glucose, total protein, albumin, uric acid, calcium, phosphorus, and BUN. And there's many other tests as listed on page 292 in your textbook. The other thing to be aware of is that platelets, hemoglobin, MCH, MCHC, and RDW will also be elevated within 24 hours after exercise as well. Patients should be advised to avoid changes in their diet and consumption of alcohol and strenuous exercise 24 hours before having their blood collected to give us an accurate sample. Stress. Emotional stress can cause a transient elevation in white blood cell count, so it could be mistaken that the patient has an infection when they truly do not. It can cause a transient decrease in serum iron levels, an abnormal hormone, cortisol, aldosterone, renin, thyroid-stimulating hormone, and prolactin values. Even mild crying was shown to increase white blood cells by 113%. These elevated counts return to basal values within 1 hour. So, anxiety can also cause hyperventilation and then disrupt our acid-base imbalance, increase lactate levels. So it's things that we want to look at and try to calm our patient down prior to collecting a sample. And I just covered this about anxiety, hyperventilation causing those changes, and just being aware that we want our patient in a calm state prior to collection. Circadian rhythm and posture. The diurnal rhythm is body fluid fluctuation during the day, causes some hormone levels to change depending on time of day. Collecting specimens during designated time periods is important for proper clinical evaluation. Changing from a supine posture to sitting or standing posture causes body water to shift from the intravascular to the intestinal compartments in the tissues. So enzyme, protein, lipid, iron, calcium levels significantly are increased with changes in position. For example, in your book on page 292, it talks about how cholesterol results 10% higher triglycerides, 12% higher HDL, 7% higher than in samples where the patient is lying down. So it kind of shows you the difference in posture changes. Positional pseudoanemia is a posture-related condition with changes in the hematocrit and hemoglobin results. This is patients that remain in bed for an extended period of time. They can cause their values to shift or change as they go from sitting to standing. It can be differentiated from the results of an acute bleed that can lead to true anemia. The healthcare worker must be helpful in providing information on the patient's posture prior to collecting these two types of samples. Travel issues and laboratory test results. Travel over several time zones affects that circadian rhythm again, and several blood analyte values are affected by this, such as hormonal levels. The other thing too is during a long flight, fluid and sodium retention occurs, which returns to normal within about 2 days. Age. Laboratory test results vary considerably during the stages of life. Blood cholesterol and triglycerides increase as the person ages. And this is primarily caused by, for example, the various hormone changes seen in patients, as well as the changes in lifestyle habits. Mastectomy. Patients who have undergone a mastectomy, surgical removal of the breast, often have resulting lymphedema on the site of the surgery or swelling. The stagnant flow of tissue fluid in the area may make a patient more prone to infections. So we will never draw, no matter the time frame, from a patient who has this. You can reference back to Chapter 7. This concludes Chapter 9, Part 1. Please view Chapter 9, Part 2 to continue with this PowerPoint.